Are you or your loved one in need of services in the home, but not sure where to start? I'm Kayla with True North Home Care, and I will explain the three main options for care services that come into the home. The three options I'm going to discuss are hospice, skilled home health, and non-medical in-home care. It's important to note that non-medical in-home care can be used in conjunction with hospice or skilled home health, but skilled home health cannot be used with hospice and vice versa. Before working as the CEO and owner of True North Home Care, I was a hospice nurse, and prior to that, I was a home health nurse. So I do have experience in all three arenas, and I love to explain the differences because I think that there are services that are underutilized for a lot of people. If you have had recent falls, recent surgery, recent hospitalization, or recent discharge from a rehab hospital or nursing home, you might need home health, which is also called skilled home health. This is where therapists and nurses are coming into your home 1 or 2 times, maybe 3 times a week, and helping you to maintain your rehab. Those are set for a limited amount of time based on your insurance and your growth. Once you hit your baseline, they cannot continue to provide services because you have to be showing improvement. Hospice is for clients who have a terminal illness or disease process that has a life expectancy of 6 months or less. That does not mean there's a time limit that after 6 months it cuts off. It just means that in general, based on current statistics, this disease process tends to have a life expectancy of 6 months or less. In my work as a hospice nurse, I know that often clients would live longer than 6 months, and sometimes they wouldn't make it to that 6-month mark, depending on how soon after they received that terminal diagnosis they were admitted to hospice services. In-home non-medical care is what True North Home Care does. We provide the physical care services for clients in both of these categories and for clients who don't need either of them. What we cannot do is we cannot provide wound care. We cannot administer administer IM injections. We cannot do nursing assessments. Those items are done by skilled nurses in either the skilled nursing home health or hospice arena. If you think that you might need something a little bit more than a care provider who's doing the bathing, dressing, toileting, housekeeping, errands, something a little bit more than that, you think you need an actual nurse, give me a call and I can help you decipher if you need a hospice nurse or a home health nurse. Both of those options are paid for by insurance and Medicare, and they might be the right option for you depending on where you're at in your journey. We would love to refer you to area agencies. While we don't ever want to tell you where to go, we do have a list of local companies that we would recommend, and you can check those out under our preferred providers and hospices page. For more questions, or if you'd like to have an in-person assessment, give me a call or give us an email at kayla@truenorthhomecare.com.